Hello, everyone. I'm just going to give it another second or two to let a few more people come in, and then we will get started. All right, we've got a good number of people in here already, so we'll get started. Good afternoon, everyone. Welcome to Webinar Wednesday, today on September 3rd, 2025. My name is Madison Lohman. I am the Member Program Coordinator here at Digital Health Canada, and I will be your host for today. I would like to begin by acknowledging the Indigenous peoples of all the lands that we're on today. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the lands which we each call home. We gratefully acknowledge that we are on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, that is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. Please feel free to share in the chat the territory you're joining from today. Today's webinar, our first webinar of the season, is eHealth 2026, everything you need to know about abstract submission. If you have any questions about today's webinar, please feel free to put them in the chat or the Q&A section, and we will get to them at the end of the webinar at the designated Q&A section. So it is my pleasure to introduce our presenters today. We have Danielle McKnight, who is the Senior Events Specialist, and we have Treasurer Ledgister, who is the Director of Conferences and Events. And I will now pass the mic over to you both. Thank you for being here for today.
Thank you, Madison, and great day, everyone. Welcome to the eHealth 26, everything you need to know about abstract submission webinar. My name is Treasurer D. Ledgister, and I'm the Conference Director.
And I'm Danielle McKnight, a Senior Events Specialist with the eHealth Conference and Trade Show. We're delighted to spend the next 45 minutes with you walking through how to craft and submit a winning abstract for eHealth. A big thank you to each of you for joining us online today. We know your time is valuable and we truly appreciate you spending it with us. We'd also like to thank Digital Health Canada for hosting this webinar Wednesday and giving us the opportunity to connect with the eHealth community. Our goal is to make this session both informative and practical, so you leave with clear tips and inspiration for your own abstract submissions.
We have plenty of valuable information to share with you today, and we'll also set aside some time for Q&A, as Madison mentioned. So if a question comes to mind as we go along, please type it in the chat box, and Madison will be keeping an eye on those. And if we don't get to the question right away, we will make sure to address them during our dedicated Q&A at the end of the session. And don't worry about capturing every detail. We'll be sharing both a PDF of the slides and a recording of today's webinar. You'll be able to find those on the ehealthconference.com website under the Submit an Abstract page. Before we get started, we're just sharing this disclaimer. This information is shared in the session is purely educational in nature. There's no guarantee that the information shared in this presentation will result in a proposal being accepted. And lastly, there's multiple factors that influence the selection of the educational programming to ensure both a balanced and compelling program. So what's next? Let's talk about the agenda on what we're going to cover on today's webinar Wednesday. We're going to spend about 45 minutes together and we'll talk about what eHealth is all about, what we're looking for in a presentation, sharing some really helpful tips, get you started, and you also get a guided tour of the abstract submission form and the resources that are available for you. And then, of course, lastly, we'll finish off with some Q&A.
What is this conference all about? eHealth is your go-to conference for connecting with leading innovators, policymakers, and thought leaders, all driven by a common goal: enhancing access, equity, and outcomes in healthcare. This gathering brings together the brightest minds from the Canadian digital health community as attendees, panelists, and presenters. It's a perfect opportunity to share ideas, expertise, and successes and challenges with peers from across Canada and beyond. Attendees include digital health executives from both public and private sectors, information and technology leaders and professionals, virtual health professionals, government and health policymakers, clinicians, patient partners and caregivers, students and academics, and emerging professionals. It has been held annually in Toronto or Vancouver since 2000. eHealth was held virtually in 2020, 2021, and 2022. Following the pandemic, we met in Toronto in 2023, where we had 1,300 attendees. We sold out in 2024 with 1,200 attendees in Vancouver. eHealth then celebrated its 25th anniversary in Toronto in June this year with 1,447 delegates. There are some fantastic videos capturing all of the greatness that was at eHealth on our website and the YouTube page. We are now beyond excited to be heading to Halifax, Nova Scotia, June 14th and 16th, 2026, and holding the event at the Halifax Convention Centre. We wanted to share a breakdown from eHealth 25 in Toronto of professional registrations by region, sector, and job category, which will help you when creating your proposal, knowing the audience makeup. As you can see, the largest percentage was directors, followed by managers, then vice presidents or senior executives, and then IT professionals. The highest percentage of sectors were from hospitals, followed by consultants, and then government.
So what are we looking for in a presentation? Well, as abstract writers, you have the chance to tell a compelling story about a project or initiative within your health system, one that has the potential to transform healthcare delivery in Canada. Whether your work highlights health equity, patient advocacy, or innovative digital health solutions, your abstract should aim to inspire action and demonstrate real measurable impact. Bring us your most innovative ideas. We're looking for submissions that showcased groundbreaking initiatives, disruptive technologies, and inventive approaches that could revolutionize how healthcare is delivered in Canada. We're excited to explore innovations from every corner of the healthcare continuum, from acute care to community care, including referrals, discharges, and home care initiatives. Long-term care, remains in an area with unique challenges, and we welcome creative, forward-looking solutions. We especially encourage submissions from First Nations and BIPOC health communities, whose experiences highlight both the challenges and successes of regional digital health deployments across Canada. Mental health is another vital focus where eHealth can make a real difference, and telehealth or virtual care continues to be an essential lens for understanding today's trends and tomorrow's opportunities. At eHealth, your ideas go national. So presenting is a unique opportunity to share your expertise, inspire colleagues, and shape the future of digital health across Canada. We'd like to highlight two important dates for the abstract submission process. The call for abstracts will open this coming Monday, September the 8th, and it will close on Monday, October the 25th at 11:59 p.m. Pacific time.
Let's get into some details about the abstract submission process and presentations at eHealth. Your presentation should align with one of these 7 conference topics and tracks. Tell us about your innovative work in Bridges, Not Silos, the Future of Connected Health, formerly Connected Care and Interoperability, highlighting data and language standardization, data sharing, public policy alignment, and shared governance initiatives that support connected healthcare system. No Patient Left Behind, Building Digital Health for All, formerly Digital Health Equity and Access, focusing on strategies to address the digital divide and ensure equitable access to digital health technologies and services. Bots, Docs, and Burnout, the Future Health Workforce, formerly Digital Technology and Healthcare Human Resources, exploring how digital technology can help address healthcare human resource shortages and optimize workforce management. Guardrails for Growth, Governing Health Data, formerly Health Data Governance, Security, and Privacy, addressing best practices for collecting, analyzing, and securing health data while ensuring privacy and balanced data sharing priorities. Power to the Patient in Digital Care, formerly Patient Engagement and Empowerment. Exploring approaches to enhance patient engagement, promote shared decision-making, and empowering individuals in managing their own health. Next Gen Care, Virtual Access, Real Impact, formerly Virtual Care, Telemonitoring, and Remote Patient Care. Examining advancements in virtual and remote care technology and program implementation and the impact on healthcare accessibility. And finally, the new RX, Innovation Meets Individuality, formerly Innovation, Digital Therapeutics, and Personalized Medicine, examining the emerging field of digital therapeutics and its potential to revolutionize disease management, treatment adherence, and personalized medicine for improving patient outcomes. All of this information is online under the submission guidelines on the Call for Abstracts page on the eHealth website.
So let's talk about the presentation types. There are 3 different types of presentations this year. The first is the e-poster presentation, second is the oral presentations, and then thirdly is the panel presentations. All of them are different ways to get your idea, your project, and thoughts across. We'll spend a few minutes here just talking about what those are. So the e-poster presentations will allow for a 10-minute presentation of a project or a case study that informs or advises the delegates of key findings or lessons learned. The audience that attends the e-poster session will have a couple of minutes to engage in questions and answers, and will have a clearly defined electronic poster format whereby successful e-poster authors will be provided with a virtual template to upload their e-poster before the conference. Oral presentations, they seem to form the basis of most of our presentations at eHealth. They're about 20-minute presentations that are often presented with a PowerPoint slide deck, and it allows the presenters to tell the story and present thoughts on a project and the implementation they're working on. Inside this, presenters have the option of a question and answer period, or it can just be a straight oral presentation for the full 20 minutes. There's a maximum of 2 presenters permitted for each accepted oral presentation, and again, it's a 20-minute session. The third and final presentation format is the panel presentation. These are 30-minute sessions to present a concept or an idea and requires 3 speakers. There's a maximum also of 3 speakers permitted for each accepted panel presentation. And this 30-minute session will include time for Q&A. So typically there would be 3 speakers presenting 3 different views of the project. So for example, you may have a technologist, a clinician, or a health systems administrator who can speak about seeing challenges or the same project from 3 different points of view. The idea behind the panel presentation is that we'd like to ignite a little bit of a live discussion with the audience, or bring forward some of the wins from those 3 different perspectives. All of these presentations will be given in person at eHealth 2026 in individual breakout rooms. So there's no virtual component at the abstract presentations, and presenters are expected to be in person. Some helpful tips that we wanted to share with you that you should have and aware of to include in the abstract body. So as we've discussed before, we're eager to hear from the visionaries who are redefining healthcare. Bring forward your projects that spark curiosity and drive innovation. Whether it's a new idea or a cutting-edge technology or a creative method, your submission should showcase a fresh perspective shaped by your setting, discipline, or approach. Your unique perspectives are invaluable, so please share them with us. And we're eager to hear fresh ideas that make a real impact in your environment and help shed light on the broader Canadian healthcare landscape. Don't be afraid to stand out. And if you're thinking outside of the box, we want to know what drives your approach and why it matters. We encourage you to look beyond your own corner of the health ecosystem and to share your boldest, most transformative insights. You're encouraged to submit projects that inspire curiosity and fuel innovation. From bold new ideas to breakthrough technologies or innovative methods, your work should stand out by offering a fresh perspective shaped by your unique setting, discipline, or approach. We welcome abstracts at every stage, even those still in the planning or early development. And if you're passionate about driving real change in healthcare, we want to hear from you. Perhaps your work is a part of a hospital or a regional improvement project. This is your opportunity to outline the action plans you'll be implementing over the next 6 months. Even if you don't yet have measurable results by September of this year, you'll be well positioned to share meaningful updates at your project's progress by May in 2026. That's when you're submitting your PowerPoint presentation. So again, if it's in early development stages now and you're still collecting data, that's okay. Include what you know, what you're projecting, and then when you submit your PowerPoint, you can put forward, the progress that you've had. So we are offering you a platform to share your day-to-day experiences, the challenges you faced, and the outcomes you've achieved. And whether these outcomes are measurable, like reducing a wait time by 10% or improving patient satisfaction by 20%, or even more qualitative, such as advancing quality improvements or reducing risk. Every insight adds value, and we're generally excited to hear your story. We also encourage you to bring a forward-looking lens to your abstract, outline the next steps in your project or deployment, and share your vision for the future, whether it's shaped by outcomes achieved so far or by the decisions guiding your next phase. And remember, you must keep the story clear and concise within the 500-word limit. Make it engaging and straightforward while defining how your outcomes were achieved and where your work is headed.
Now let's walk through how to submit an eHealth abstract and where to find all the key information, guidelines, and forms. Everything you need is available on the ehealthconference.com website under the Submit an Abstract drop-down menu. From there, you'll find the Submit an Abstract page where you can review the instructions and requirements. When you're ready, simply click the link to access the submission form in Submittable. The link goes live on Monday, September 8th. A quick but important reminder, submissions close Monday, October 20th, 2025 at 11:59 p.m. Pacific time. I want to make sure we indicate that Pacific time. That means that if you're on the West Coast, you'll have a couple of extra hours to finalize your submission. All abstracts will undergo a blind review by our diverse abstract review committee, which includes patient partners who play a vital role in shaping the program. This ensures that patient-centered perspectives remain at the heart of everything we do. The next few slides, we will walk through screenshots of the actual submission platform so you can get a sense of what to expect when you begin your abstract submission. For new submitters, the process starts on the left-hand side of the screen. You'll be guided to create a new account and complete some mandatory fields. We recommend using your official work email address so we can reach you if additional information is needed. Once your account is set up, you'll receive a confirmation email, which will allow you to log in and continue working on your submission. This means you don't have to complete your abstract all at once. You can save a draft and return to it later, as shown on the right-hand side of the screen. If you're a returning submitter, the process is even easier. You can log in using the same account from previous years. There's no need to create a new submittable account each year. After logging in, you'll land on the submission summary page where you can see abstracts that are in progress, already submitted, or even deleted if you chose not to submit them. There are 13 sections in the submission process, and we'll take you through each one briefly so you know what to expect. Look for the red required label indicating the required fields. We begin by collecting your contact details. While these questions are standard, they're essential, as this is how we will reach you if needed. Remember, the red required marks are the required fields. And don't worry, this is a blind review process, so your contact information will not be shared with the abstract reviewers.
So tracks and the topics. Next, we'll move on to the presentation information section. And here you'll choose from the 7 main conference topics and tracks that Danielle spoke about earlier, indicating which one best aligns with your abstract submission. And as a reminder, the detailed conference track descriptions are available under the submission guidelines on the Call for Abstracts page for the eHealth website. Please note that the program committee may adjust the track assignment when preparing the final program if needed. Start by giving your presentation a descriptive and attention-grabbing title, and we've increased it this year, but we'd like you to still keep it under 20 words. Next, you're asked to craft a 75-word summary. We've increased it from last year, and this is a key piece as it distills your abstract into 1 or 2 concise sentences for the program. Keep in mind that your title and summary will appear on the conference website and in the conference app. The program committee may adjust or shorten them when finalizing the program if needed, but be creative. Next comes the body of the abstract. So now for the meaty part, we'll dive in how to build a successful e-health abstract. A quick but very important reminder, your abstract must remain within the 500 words. Every word matters, and content beyond this limit will not be included or reviewed. So to help you stay focused and to make the most of your space, consider structuring the abstract around 4 key elements. The first, purpose and objectives. Second, methodology and approach. Third, finding results. And then lastly, the conclusions, implications, or recommendations. And this will ensure your abstract is clear, concise, and impactful. Like an academic approach, this method presents the reader, who is the abstract reviewer, with a concise way to understand what your project's about, which is the purpose and objectives, how you approached your challenge under methodology. Your findings and results will be those, exactly that, the results. And then lastly, what did you learn or you'd like to share with the Canadian eHealth community? And you'd include those under the conclusions. Another helpful tip is to keep an eye on the word counter at the bottom right corner of the text box. It's circled on the slide. It shows you the current word count as you type. And also be sure, absolutely sure, to remove any identifying information from your abstract, such as the project names or the institution or organization names. Please keep them out of the title, the summary, or the body. This ensures a blind review. And again, abstracts that include the identifying details will not be evaluated. So please triple check this before you're submitting it. Patient partners, as we know, bring invaluable wisdom and lived experience to the eHealth conference, and they are at the heart of everything we do. So we strongly encourage abstract submitters to include patients and patient partners in their research or even as co-presenters whenever possible, helping to ensure a rich, more meaningful perspective in every abstract. So let us know how patients or patient partners were included in your project or your research.
The next step is to indicate your preferred presentation type. Like Treasurer's gone over before, you can choose from the 3 options: panel presentation, oral presentation, or e-poster presentation. If you need a refresher on the details of each format, click the link below the question for the full descriptions. In question 7, you'll also have the option to select an alternative presentation format, giving you flexibility to explore options beyond your initial choice. This helps us create more diverse, engaging conference sessions. For example, if you prefer an oral presentation, but your abstract aligns well with other topics, we may suggest combining 2 abstracts into a panel presentation to foster a dynamic discussion. We'll keep you informed of any recommendations to ensure your abstract fits smoothly into the overall program. While we're flexible with panel and oral presentations, we tend to honor specific requests for e-posters. This format is ideal for showcasing detailed, graphic-rich content with a strong focus on visual data and numbers. Please indicate whether you are submitting the abstract as the primary presenter or on behalf of someone else, such as a colleague or supervisor. While there's no limit to the number of authors, only 1 lead presenter is allowed per submission, even for panel abstracts. The primary presenter will receive a reduced fee conference registration, while additional presenters will be required to pay the full registration fee. We ask that you include the full first name, last name, phonetic spelling, email address, and phone number. Be sure to list all presenters in your abstract submission. You can include an optional additional presenter for oral presentations, and panels require 3 panelists, which can be added under questions 9 and 10 of the application. If your abstract is accepted as a panel presentation, reduced fee conference registrations will be extended to a maximum of 3 panelists. There are also 3 key presenter acknowledgement questions in the submission process. 1, confirm your understanding of the format and the maximum number of presenters for your chosen presentation type. Acknowledge the registration requirements. All accepted presenters listed in your submission must register by February 27th, 2026. We encourage accepted presenters to seek approvals and funding early to avoid delays and ensure timely registration. And 3, acknowledge blind review compliance. Confirm that all identifying information has been removed from the title and body of your abstract to enable a fair blind review process. Now you have the option to save a draft and return later to complete your submission. When you're ready to submit your winning abstract, simply click Submit Form. If any required fields are missing, they will appear in red links and a red box. Just fill in the missing information and you can either save your draft again or confidently submit your abstract.
So when will you find out the results? Well, successful submitters will be notified during the week of December 1st. If you're selected to present at eHealth, you will receive an email with this exciting news, and the email will be coming from Submittable. Make sure you don't miss this update. We recommend setting a calendar reminder for yourself and checking both your inbox and your spam filters and folders in December. Please note that abstract titles and presentation types may be adjusted as needed, and all selected presenters will need to confirm their attendance in the Submittable portal by December the 12th to secure their spot. So you have from the 1st to the 12th to acknowledge within Submittable that you are going to present and accept to present. The graph indicates the eHealth 25 ratio of submissions to accepted. And I just want to point that these numbers really show it's very competitive with the best of the best proposals being accepted. We had 399 submissions last year and 86 were accepted. So for the latest information and updates, visit our website regularly. We're constantly refreshing it and sharing great news to keep you informed. Resources. We'd like to highlight some helpful resources to support you throughout your submission process. The main conference website is ehealthconference.com, and it's your go-to source for all of the information that you'll need, including where to submit your abstract, submission guidelines, and the downloadable submission template on the eHealth Call for Abstracts page. We strongly recommend submitting early rather than waiting until the last minute. I can't emphasize that enough. Submitting close to the deadline can create technical issues or delays, and by submitting early, you will have plenty of time to address any questions or concerns, and our eHealth team will be able and ready to assist you promptly. We actually do look and review the abstracts quickly just to make sure that they're blind reviewed properly, meaning that there's no identifying information. And if we find some, we will send it back to you to give you an opportunity to remove it before the portal closes on October the 20th. So it's important to keep your eye open on your emails between submission and the closing date of October 20th in case you are contacted for a revision. If you need technical support or have questions about the abstract review process, please email the eHealth 26 speaker and abstract management team at speakers with an S, speakers at ehealthconference.com. And remember, if you have any questions or need help at any point, don't hesitate to reach out to the eHealth conference team, to myself or Danielle directly. We are here to make sure your submission process is smooth and stress-free. Please take a screenshot of this page if you can, because it highlights some very key important dates that we'd like you to remember. So first off, the abstract submission period opens on Monday, September the 8th, and closes on Monday, October the 20th. The review period, where our abstract review committee will begin reviewing the submissions, begins shortly after the deadline, and they will complete their work by the end of November. Notification week, the notifications will be sent out again during the week of December the 1st. And if you're selected, please confirm your acceptance to present by December the 12th. We ask that you wait until this date to inquire about your application status. You'll be notified very, very early within the first 2 or 3 days. And so the program committee will then finalize the conference program through January and February after the December 12th acceptance closes. Registration. Registration is so exciting. This will begin on January the 5th, their first day back in the new year. And we do have a deadline for selected presenters. Again, we are asking for them to be registered by February the 27th. You will know that you have been approved from December the 1st or 2nd. So between that time and February 27th, we're asking for you to please get your approvals that you need and to confirm your speakers so that the registration can be completed by that date. If not, I'm sure you'll get a friendly reminder from our registration coordinator, Melissa, to get your registrations in. Please remember that one primary presenter per submission will receive a reduced registration fee, and then any additional presenters will need to pay the full conference fee, except for panels, where the panels, a reduced fee is available for all 3 required panelists. And please note that speakers are responsible for their own hotel and travel expenses. Additional deadlines, just to make sure you're aware of, the call for speaker headshots and biographies. So get your hair done, makeup done, everything done by March the 31st, because we need those headshots and your biographies. The official program will be published on the website after all speaker bios and headshots are in. And then if you choose to present with a PowerPoint presentation, which will be our platform of choice, is the PowerPoint software, please make sure that it's submitted by the May 8th deadline. And again, if you submit it early and we have the opportunity to review it, we can send it back to you for revisions, but we do require it by May the 8th. Lastly, the eHealth conference will take place June 14th to 16th, and the abstracts presented must be in person during the concurrent sessions. All right, Danielle, over to you.
Alrighty, before we wrap up and open the chat for questions, let's review top 10 tips to help your abstract stand out and understand what the abstract committee evaluates. So 1, tell your story. Be clear and concise when describing your innovation and its impact. Share why you started this project, what motivated you, and the results or outcomes that demonstrate your contribution to digital health. 2, create a flow. Think of your abstract as a narrative with beginning, middle, and end. Include objectives, activities, results, and a forward-looking conclusion that supports the next steps for your work. 3, show your work. Highlight successes using data and real-world examples. Illustrate how your work is making a difference and emphasize key objectives, activities, and outcomes. 4, outline your next steps. Explain how your work has influenced your organization and how it will advance eHealth initiatives. Reflect on both successes and challenges and describe the future impact of your project. 5, offer something new. Bring originality to your abstract. If your approach or technology is innovative, explain how it stands out and why it matters. 6, align with the conference tracks. Make sure your abstract fits one of the conference tracks. This helps us place your work in the right context and audience for the conference. 7, engage your audience. Make your abstract interesting for attendees and peers. Think about what will captivate them and why your work should excite them. 8, craft a strong title and summary. Create a concise, compelling title that captures the essence of your work. While the program committee may refine it, give it your best shot to make it engaging and informative. 9, be clear and focused. Ensure your abstract is well written and easy to understand. Have a team member or colleagues review it to confirm clarity, focus, and spelling. And finally, number 10, avoid vendor sales pitches. Focus on insights and findings, not sales. Speakers are selected for their expertise, not promotional content. Vendors have a dedicated exhibit area to showcase those technologies.
Okay, we've spoken a lot today, so we want to now ask if there are any questions or comments that we haven't addressed yet. And Madison, please help us through this. If you could maybe monitor the chat box or the Q&A and let us know if any questions have come in.
For sure. Thank you guys both for your presentation today, by the way. It was great. Lots of great information. So a couple of questions that I have answered in the Q&A already, but I'll just put that out there. We were asked if the webinar recording will be shared. So just again, if we could put that out there. I know we gained a few more people probably before we set it at the beginning. So will our webinar be recorded and shared for later?
Yes,
Yes.
will be. Yes, yes. Otherwise,
Perfect. Okay.
it'll be published on the call for abstract page. So right under the webinar section, you'll have a PDF of the slides and you'll also have a recording.
Awesome. Perfect. So there's that one. We have a couple of questions in the Q&A right now, so we can get to those. The first one we have, when you say leave out quote product names or institutional names, what do you mean by this?
Can I take that one, Danny?
Sounds good.
So for that, what we're saying is instead of saying the project is ABC, maybe just say the project rather than actually identifying your institution or your company name, Kai or Infoway. Remove that and say the organization. So this way, there's nothing that identifies you or your project.
Awesome. And then we have another question here. If a panel, would a moderator count in the three or be allowed as an add-on?
I can take that one, Treasure. So a moderator would be counted as your 3. There would not be an add-on. You can only have the 3 speakers on the stage.
If I could clarify, Danielle,
Yeah, of course.
for our concurrence, we actually have the moderator program. Remember, we have the
We do the session facilitators. We do have session facilitators that will do the introduction and help you facilitate any Q&A.
correct. So for those sessions, the moderator is actually not counted. Your 3 speakers would be your 3 speakers. We would provide a moderator for you for the session. And again, it's just the concurrence that we're doing this for.
Awesome, perfect. And then we have another question here. Is there a limit to how many abstracts an organization can submit?
No limits. The more, the merrier. As long as they're good quality, absolutely. There's no limit.
Okay, well, we don't have any other questions right now, but we do still have time. So if there are any other questions, please feel free to put them in the chat or the Q&A, and we can get to them. While we are waiting, I will do maybe the satisfaction poll, if that's okay with you guys. Just to kind of pass the time, we've got a satisfaction poll here. It will just take a couple of seconds. If you guys can fill it out, you'll see it on screen in a couple of seconds. If you could just give us a little rating, it does help very much with our future sessions and kind of seeing what works, what doesn't work. So we would appreciate your input there.
Madison, maybe while they're doing the poll, we can talk about the fact that we hope that the webinar was helpful and that you feel inspired as you prepare for your submissions. Again, please don't miss this chance to contribute to our shared mission of enhancing access, equity, and outcomes in healthcare. And if you need any support along the way, the eHealth team is here to assist you every step of the process. We really can't wait to see your contributions, and we're looking forward to an engaging and insightful conference in Halifax, Nova Scotia. We're so excited. We're very excited. Any more questions?
We do have another one that's come in. For a panel, do we need 3 speakers, or will you group 3 speakers based on topic?
Excellent question. So yes, the panels, 3 speakers are required, and during your submission, your abstract submission, you must identify the 3 speakers that you plan to present during your panel. So their details must be included in your abstract submission. If we find that there are abstracts that are similar and we are looking to pair them, we would approach both parties and see if there's an opportunity to choose which speakers would best suit it. But yes, all 3 speakers are required when you submit your panel presentation.
Perfect. Okay. And maybe I'll do kind of like a last call for some questions. You can either put them in the chat or the Q&A, and maybe we'll wait just a minute or so. Just get some last minute questions in there. If not, I will kind of continue on. I'll just mention while we're waiting, just a quick mention of our community platform, which is available to all Digital Health Canada members. I encourage you all to log in, join us on the community and start a discussion. All of our Webinar Wednesday recordings, including this one, will be located on the community platform. So you are able to see all of the past and future webinars. You can also see any news updates. You can join some groups, ask some questions, and we are doing some fun stuff for our 50th anniversary of Digital Health Canada. So you can check that out as well over there. And we've also got our Digital Health in Canada podcast, which is our monthly podcast that you can check out on all of all podcast platforms. So anywhere that there's a podcast platform, you can find us there. You can follow and listen monthly. We've got a lot of fun updates and a lot of interesting topics that we are working on. Again, with our 50th anniversary of Digital Health Canada, we are putting out some really good episodes. And I do actually have another question. Well, just before we go, so we've got, if you see your topic fitting multiple streams, is there an opportunity to indicate that on the submission?
Go ahead, Danny. That was
Yeah. Yes, you can indicate which streams you believe that they would fit into, as well as the committee will review as well and see if it does fit the multiple streams, which one it best represents.
Great. Any last comments from either Treasurer or Danielle?
We're so excited. We're excited for eHealth 2026.
we get your submissions in early, and we look forward to receiving them.
Perfect. Well, thank you guys both for this amazing presentation. It was so informative, and hopefully everyone attending got some good information. And I hope that everyone has a great rest of your day. Happy September, and welcome back to our weekly webinars. All right. Well, everyone have a great day, and thank you all for joining us today.